Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. Today, I am super excited to have a very special guest, Michael Cruz, who works at D for Dentist in Las Vegas, Nevada, and his official title, which I love, is Zookeeper. How are you doing today, sir?
I'm fantastic. Thanks for having me.
Oh, no, I just appreciate you being on board. And I mean, I've gotten to know a little bit about your practice, and I think your practice is kind of the type of practice that anybody listening would be like, I want our practice to be like that. So just on the front end, could you just tell us a little bit about your practice?
Yeah, we're actually turning 10 years old next year. My wife, Dr. Didi, hence D for Dentist, is the primary doctor there. We just expanded last year, filled up our last op, so we're working out of 8 operatories. We have pretty much all the technology you could want. We got the Prime Scan, the Cerix, the Opera VR. We use Opera DDS. We have the cone beams. We do sleep, implants, pretty much everything you could think of. It's a dentist playground. And so this year it's probably been our biggest growth year. We now have 4 providers in office. We have my wife. We have an associate. We have a prosthodontist who we just did a merger with. So he's moved his practice into ours, and we also have an endodontist as well.
Wow, that's so. What because obviously you have lots of moving parts and lots going on. What do you feel like you do well? Like, what is your specialty like as an office?
As an office or me personally?
Well, both.
I think as an office, I think what we do well really, and this was intentional from the start, was the patient experience. I think when you're working with a limited budget, when you start up, you got to find those ways to really set yourself apart from the rest in ways that are tangible. And so, we really focus on those things. And so the experience is, I think, where we really shine. And as a part of the experience, you want to make sure you can do as much treatment for the patient in one location, because that's convenient to the patient. It's convenient for their time, those kind of things. So it all revolves around the experience. Personally, I would say my strength is probably high level overview of practice growth, and then managing team members to grow. And when I say managing, it's really helping them grow. I don't really get involved in the day-to-day operations of the practice. If you ask me, how to schedule something, nobody wants me touching the schedule in the practice. I'm pretty much not allowed at the front desk.
Well, yeah, we share that in common, my friend. The patient experience is pretty much one major reason why we do the podcast. And typically speaking, we actually have somebody who provides the patient perspective on the podcast, unless we're doing something that's like this, very directionally focused towards dentists or dental team members. And I love that that's kind of like what you do well. And so there's probably a lot of people out there who, like you're talking about, when you first started 10 years ago, your practice and budgets were tight or whatever. What would you say to them? Like, what advice would you give them to help grow their practice by focusing on the patient experience? What would you tell them?
I think the number one thing is you got to look at what you want, as your own personal team culture. It starts with the doctor, has a vision there. I think where a lot of people get tripped up is they try to be some other practice. They say they're doing that, I want to do the same thing, but it's out of their comfort zone. So, I'm very much of the keep it simple. What would make you happy, attract like-minded, people, and put those things into place. So, we really made it comfortable, because I wanted a place that was comfortable. My wife wanted a place that was comfortable. We wanted a place that smelled nice. So, we invested in Scent Air, which, put out a signature scent for the practice. We wanted, comfort. So we made sure, that all the amenities were in all the operatories. We had purse hooks. We had, obviously you got the TVs with those kind of things. And then, later on down the road, we invested in VR and those kind of things. But you really look at what do you want for your practice, and I think that makes it a lot easier, because when it's something that you want, you find ways to get it done, and it's a natural conversational kind of thing, as opposed to putting something in that you saw work somewhere else that feels very foreign to you. So a lot of that you can do. One of the big things, which is hilarious, when we first started, our patient restroom, we had like this huge selection of lotion. My mother had a cosmetics company, and she just had all these lotions, like samples, and she gave it to us, and we just like put it in the bathroom. And I remember our first few Yelp reviews, we're focused on technology. We had, all the new cameras and sensors and everything. And the reviews were like, they have 10 different lotions in the bathroom. It's amazing. And so, that was unexpected, but those are the things that people look for. And it's that. It was that simple. That cost us literally nothing.
Yeah, I agree. And I was, as you were talking about scents and things, I think you're talking about like, frankly, I think that you're talking about like how to shave milliseconds off your marathon time compared to like somebody who's just starting running, right? I mean, and I think of like many offices out there who are still using like a clipboard and a piece of paper, right? I mean, like, what would you tell offices who are just starting out, and like, what are the technologies and things that people can put in place that are the equivalent of the lotions in the bathroom, where they're like,
Yeah. I think technology is the great equalizer. I mean, if you're competing against all these big corporate practices and things like that, it's tough. And then the other thing that really kills us running a practice is obviously labor, right?
Mm-hmm.
People are, unfortunately, sometimes not as dependable as you would like. So technology really helps with a lot of that stuff. So I think that some of the key things that you would need is going to be, a communication system, something that auto confirms appointments and things like that. Obviously, you hope it integrates well with your practice software. Something that does, again, it's seconds, like you said. That's really, when we have our team meetings now, it's always like, we need to increase production. Hey, the schedule's full. Where are we going to put that? It's minutes. That's all we're looking for. Sarah, can we cut down 10 minutes here? Opera, can we send out forms and get that ahead of time so the patient's ready and we don't have to worry about that and we don't have to scan it? I mean, really, if you take a look at when we used to scan paper, what you're paying in labor to do that and get it in the PMS system and the IT issues that come along with it versus just sending it to the patient, they do it on their phone and it's automatically in the PMS and it's done. Oh my gosh, game changer. And, obviously Opera is one of those great things that does all of that.
Well, thank you. And we are right now doing that math, like looking at the averages in the practice, and like it's shockingly high how much money you're saving by going paperless. But you are the zookeeper there, right? And there's quite a few animals running around. And when you put paperless forms in your practice, as sort of a simple, because I view that as like kind of like digital x-rays are to clinical dentistry. Like everybody should be doing it, right? And once you switch, there's really no going back. And I think, first, would you agree that that's kind of how paperless forms are? And then did you get any pushback from your team?
No, I 100% agree. No, I think we have the luxury of having a relatively young team where, they were born in the age of technology. So I didn't get a lot of pushback. You're going to get, and for us, we're very purposeful when we bring on new technology that we have buy-in from our key players, that they have input on, which technology we choose, because, in the beginning, we've run into that where, Doc comes back from a convention, she's excited and, hey, we're going to do this thing, and has no support from the team. And you don't want that. Everyone's been there. And so we make sure that they have some input. We talk about how we're going to integrate this. What challenges are we going to face? What objections are we going to get from patients? And really make sure we're covered on all of our bases. And then on the flip side, so we just did this merger with a pros practice. They've been in practice for 40 years. Doc's kind of on the tail end of his career and wanted to join our practice. And they came, paper charts, and it was really a blessing because the merger happened over COVID, so we had some time to train them. And I remember it was funny because the doctor's office manager, who also happened to be his wife, was saying, we have a lot of patients. They don't use texting and they don't do this. And surprisingly, we haven't seen that much pushback. The patients are texting, the patients are doing their forms online, and we're talking 70, 80, 90-year-olds. And if it's not them doing it, it's probably their children or their grandkids helping them out, and they're used to it too. So I think it's very simple. It just takes a little bit of front-end effort, but, I mean, it gets done. And it makes the team, it just makes everything so much easier. And you get your team to focus on more important, revenue-generating tasks.
Yeah, and I think right now, particularly, we were talking about it before we started recording the podcast, that team members are shuffling around, and a lot of people are sort of training new people, having turnover. And I feel like just like you said, leveraging technology, that, technology doesn't get sick. You don't have to retrain it, right? It just kind of turn it on and it does its thing. If somebody's thinking about doing, like you're talking about with Opera DDS texting and paperless forms, that doesn't do that today, what advice, what would you tell them?
My advice is just look for something that really works well with you and your team. I think one of the things, and this is not to toot your horn, Doctor, I think one of the things that I loved about Opera was it was system agnostic. It was web-based. I didn't have to get one specific app. There weren't a lot of hurdles to jump through. Everyone knows how to use a website. Everyone can access it. If the computer's down, I can go to a different computer. I can use my phone. I think that was one of the big things for us because I wanted it to be easy to train. So I would look at that, look at what your staff is capable of and what would give them the least hurdles to jump over would be the biggest thing.
So do you have your staff involved early on in the decision-making process of we're thinking about doing this? Or do you just kind of say, because I was more of the voluntold perspective, right? When we bring something, when we bring something to the office, I usually do the vetting and then say, here's what we're doing, which has worked well, frankly, because we have the right people in place, like you talked about. But maybe people don't, you would recommend getting the team involved in the decision-making process right away?
I think it's a little similar. I don't waste my team's time in vetting everything. My job is really, I ask them, we'll talk and I say, hey, what challenges are you facing? What could help you right here? And they tell me the things that really bother them. For them, it was scanning. The scanner would go down and, the scan folder would get backlogged. And then every month you'd have to have someone sit in a room and, hey, clean this folder up. And so they were running into those challenges. And I said, hey, what if we could solve that with this technology? Would that be good? And so we checked out a couple different ones, and then they kind of look at the pros and cons of it because I only know from, like I said, I know the top down overview, but they're the ones that say, well, this is what we do. This is how the patient responds. This is the day to day of the integration with our practice software and things like that. So they're the ones that really kind of pull the trigger on which one we go with that's going to work best for them. I think my job is really to help guide them and say, hey, this might fix it for right now, but how does this look 2 years from now, 5 years from now? Does this still work for us in the path that we're headed down? Because you also want to take that into account. You don't want to, we've all been there where we kind of did this one thing and it worked and then all of a sudden it's outdated. So you want to make sure it works for the long haul too if you're going to invest in it.
So you actually had your team come to you and go, scanning, pain in the ass. It's always broken. And then you found a solution that kind of, is that how it worked? Oh, yeah. Yeah.
We went years with, scanning. And, I think that's one of those things. It's like the hazing period. You got to go through it, man.
Yeah. I think my first one was because my practice is 20 years old. We still had the paper appointment book. And so I don't know if you ever, I don't think you're old enough to have gone through that fresh.
When we started, my wife, she was doing paper charts because that's where she was working at the time. She was renting a chair at a doctor's office, and they were paper charts. And when we started, it was me running the front desk. I had no dental experience. It was her. She was teaching me how to read her handwriting, and what does this mean, and doing all the accounting by hand and insurance write-offs. And I was like, hey, we need to do this digitally because this is not going to work. And so we immediately switched to digital from that point on.
So if you could go back in time and talk to yourself 10 years ago, where would you start?
Where would I start? I mean, in terms of practice, like the physical stuff, or just growing the practice?
I would say from when you were up at the front desk, your biggest pain point, like what would you implement 10 years ago, first thing to alleviate your stress?
Gosh. First thing would be patient communication. I mean, not having to make phone calls and those kind of things, and just getting it, did we click that button? Who got in touch with that person? Is this really unconfirmed? Oh, those kind of things. Oh, those drive you crazy. Getting that off your plate is huge.
Well, that's awesome. And I mean, kudos to you. You're one of those people that I think took the COVID shutdown when you merged the other practice to you didn't just watch Netflix. You kind of, we talked a lot during the shutdown on the podcast about kind of now is the time to do those things that you don't have time to do, which you definitely took advantage of that downtime to regroup and then came out swinging. And I mean, not too many practices can say that this year has been their best year ever. And so kudos to you. This is definitely, if I looked at, we closed out September last year, and we're at what we did last year. So the rest of these 3 months is just beating what we did last year. So we're super stoked about that. Well, and I think the reason why, kind of wrapping it around, is I agree completely, and I would say that it's because of your hyper focus on delivering the patient experience that you would want to have anybody experience, and that's not tangential. It's everything from the paperless forms and sense you have in your practice to kind of I know. I've met your wife, who's an amazing dentist, and you guys just appreciate what you're doing for the profession, for what you're doing for your patients, and you have a very cool zoo. So thank you, my man.
Thank you very much.
Yeah, appreciate you being on the podcast.
Thank you for having me.